All right, it's going.
This is Cece the duck. She got her foot caught in a rat trap. We have to remove her toe. As you can see, she cannot walk. We're going to give her some Novocaine right now to numb it. We're going to wait 5 minutes after we numb with the Novocaine, Lidocaine, whatever Dr. Kim is using right now. I believe it's Lidocaine she's using. So we have to wait for that to take effect.
All right.
We're going to have to wait a few minutes for that to take effect, and then we're going to have to remove that toe. As you see, there's a little bit of blood there. Okay. The doctor's going to be putting on her gloves in a second to get ready to cut this toe. As you can see, there's quite a bit of swelling. Cece is a very good patient. She's been in so much pain. Now she's just enjoying not being in pain right now. As you can see, she's very, very gentle right now. She's been in so much pain. You see her head?
Mm-hmm.
Yeah. Maybe she'll be able to get some sleep today. We're hoping. It's okay. Cece's a good girl. Take it easy, Cece. As you can see, you gotta put your, can't see. As you can see, the doctor's cutting off. Yeah. She can still feel it a little bit, but not as much as she would have. Okay. Now what we're going to do at this point, the doctor's cleaning it up. You want to have as sterile as you can environment for her. Okay, as you can see, it has been removed. We didn't want to take off any more than we had to. Now, what are you putting on now, John?
Wick stop.
What is it?
Wick stop.
She's putting on wick stop right now. We're trying to stop the bleeding. There's not a lot of bleeding, but the little bit there is, we want to stop that so she doesn't bleed out. And that there is wick stop also.
This is neomycin sulfate, and it keeps the foot dry.
Okay.
And it stops the bleeding.
Okay. So that's neo what now? Myosin?
With trachocaine powder, neomycin sulfate.
Okay, and what does that do, doctor?
It keeps it dry.
Oh, great.
Like on a dog when you amputate their toe, keeps it dry.
Okay.
Now we're going to bandage her up.
Okay, I'm going to go ahead and hold that foot so she doesn't move. Cece is a very good patient, as you can see. It's okay, Cece. As you can see, it dried it up. There's no more blood coming out. That's very important. You do not let them bleed. The doctor's going to go ahead and bandage her up. You don't want to make it too tight. You don't want to cut off the circulation, but it has to be on there tight enough so she doesn't throw it off. It's okay, girl. Once we've completed the surgery here, we're going to put her into a sterile cage. We use newspapers, which works fine. You don't want to use hay. Newspapers or some kind of a paper is the best for them. You also need to limit their movement. So we have a fairly small cage. Normally she would be in a bigger cage than this, obviously, but we want to limit her movement today for a while. Almost, you see. Okay.
And 150 milligram of penicillin.
And 150 milligram of penicillin.
Straight in the mouth.
Straight in the mouth. And Doc, does that get done? That's what was taken off. of her. Now, how the penicillin, doc, how many times do you give them the penicillin?
Once in the mouth and then in her drinking water.
Okay.
She'll drink it all day.
Okay. And do we do that for a few days, or is this going to be...
It could be a week. It could be 3 days. Depends on how she's healing.
Okay, great.
All right, let me go get the penicillin.
Okay, the doctor's going to go get the penicillin. It's going to go directly in her mouth, and then we're going to put some in her water, and it would take between 3 days and a week for her, obviously, to start healing up. You want to check the bandage every day. If you need to change it, then you'd go ahead and do that. Cece's very tired right now because she has been dealing with this pain. So she will go to sleep once we... Now, as you can see, the doc is going to administer the penicillin. How many milligrams is that?
150.
And again, that's 150 milligram penicillin. And you put it in her mouth like so. Then there's going to be some kind of liquid that we're going to use. Then you're going to
wash it down with water.
Then you would wash it down with water once you put the penicillin in her mouth, so she doesn't spit it out. Make sure you close her mouth and hold it. She's going to try and spit it out, so you're going to want to make sure it gets down there. Okay, no problem.
All right, she's ready for her box.
Okay, she's going to go in her box now. Cece is a very good little patient. I'm going to put on this side. This one is the clean one.
Okay.
And that is the end of the surgery for Cece the duck. Hope this will help you in the future if you have a emergency situation like we had over the holiday. Have a good day, and thank you for watching.